Swadikap and good afternoon once again. Today is Thursday, the 28th of April 2022, and this is the English language summary of the press briefing, weekly press briefing here at the Center for COVID Situation Administration, or CCSA, as always. We'll be here with you, of course, until we get rid of COVID finally, and of course we see the tides of change in the numbers and of course also the measures as far as Thailand is concerned. So first of all, thank you to Dr. Sumani for the Thai language version. The Thai language briefing just now recapped the outcome of the general CCSA meeting, which was held last Friday as well. And this includes the recategorization of provinces under the color-coded system, as you are familiar now with the color codes of the provinces. Or in terms of the public health measure coding as well. So as of the 1st of May 2022, 65 provinces will be in the high surveillance or yellow zone, majority in the yellow zone, and 12 provinces will be in the tourism-oriented or blue zone, as you see in the infographic there on screen, courtesy of, well, sourced from the CCSA, but courtesy of the Bangkok Post. And Rayong and Songkhla provinces are the two most recent additions to the blue zone with measures that you see on screen. So in the blue zone, as you recall, the first ones were Phuket and the rest, and now Rayong and Songkhla are added to that list of tourism-oriented blue zone provinces with their specific measures. So now we have only yellow and blue. So moving on to a recap on the updated entry measures. Allow me to recap the updated measures for air travel to be effective from the 1st of May 2022, wherein the CCSA has resolved that fully vaccinated travelers entering Thailand are no longer required to take a COVID test before or after arriving in Thailand, and that they will be exempt from quarantine. Self-ATKs are still encouraged, particularly if experiencing symptoms. And unvaccinated travelers have the option of providing a negative RT-PCR result within 72 hours prior to departure to be exempt from quarantine or to quarantine for 5 days in an alternative quarantine or AQ hotel and to take the RT-PCR test. Unvaccinated travelers also who choose the first option are required to upload their RT-PCR result in the Thailand Pass system before departure. These new measures are pending official announcement in the Royal Gazette, which is expected at the end of this month. So just a recap for the majority, which is those who are fully vaccinated entering Thailand no longer required to take a COVID test before or after arriving in Thailand. And self-ATK is encouraged, still encouraged. Now for all non-Thai travelers are required to prepare proof of insurance, at least $10,000 coverage for medical treatment in the country. And children under 18 years old can register under and travel with their parents, register under in the same account as their parents and travel with their parents. This information can be found on the Thailand Pass website and on the MFA, Ministry of Foreign Affairs, media outlets, and as shown on screen as well. Update on the arrival numbers of travelers and Thailand Pass. We have coming up for you a slide. That during most of the month of April, the 1st to the 27th of April, we have 338,364 travelers entering Thailand. Mostly, of course, in the test and go system, as you see the numbers and details on screen. I won't go line by line on that. You can see that on screen right now. And of course, the briefings will be available on our social media channels like PR Thai, meaning PR Thailand, the PR Public Relations Department, Facebook page, and other sites as well. On the international travelers, the origin of international travelers, they come from top 10 countries as shown on screen. Now just to note that Thailand's border provinces will open to neighboring countries on the 1st of May 2022. Now there are 2 provinces remaining in that exemption, which is Nan province and Ubon Ratchathani province. They are the 2 remaining provinces with international borders which are still considering measures. So in the context of international travel and international borders, I think this information will be useful for the English language version of this briefing. Nan and Ubon Ratchathani. So to be confirmed in terms of their easing of measures. Now on the general situation to date, we'll have the usual infographic, easy to understand infographic coming up for you. New confirmed case, 14,437, reflecting a general downward trend. And we have the other numbers on screen for you. Importantly, 127 new fatalities, which is fatality rate now standing at 0.33%. There had been more than 100, the number had been more than 100 in terms of fatalities for the past 19 consecutive days. And as far as the rise in fatality concerned, the majority are from the usual group of elderly, medically vulnerable groups, and those who have not been vaccinated or vaccinated with the booster dose. Now, those who have recovered from COVID-19 infection are to remain vigilant, even if their case is not severe. It's because of you're familiar with the term long COVID. Of course, that's still quite worrisome. And some common symptoms for long COVID are shortness of breath, dementia conditions, and lack of concentration, and trouble sleeping. And there are that infographic on screen for you. Let's turn now to the top 10 provinces. We have, as usual, in green, which means less than the previous days, and red, more than the previous days. First is Bangkok, and that ends with Nakhon Pathom at number 10. Just to note that Dr. Sumani also highlighted an important point that health authorities now are conducting further studies to determine whether the fatalities that we have seen so far have been occurring from actual COVID infection or from existing chronic diseases. Of course, it's kind of difficult to determine that or separate that, but because many people with chronic diseases have been infected with COVID, and they will make a point to try to distinguish that into detail. In terms of vaccination progress, we have a slide coming up for you, administering over 150,000 doses yesterday alone. Cumulative is 132.97 million doses in Thailand already. First dose above 80%, second dose above 73%, and booster dose above 36% now. And the CCSA, of course, continues to encourage everyone, especially the elderly group, to get a booster dose when they can, to boost their immunity and reduce the possibility of severe symptoms should they contract the virus. And to reach the endemic stage, the fatality rate, to reach the endemic stage for Thailand, there's been much talk and discussion about that, as opposed to pandemic, transitioning to endemic. To reach that, the fatality rate must not exceed 0.1%. And more than 60% of the population must have received their booster dose. And so before final closings, I'd like to thank first, this is about international cooperation, as we always have reported. Thank the Indian government and its partners for the 200,000 Covovac doses, which will be distributed to state-owned hospitals across the country. This latest shipment of vaccines reflect our policy to ensure that everyone residing in Thai soil has access to a variety of vaccines and that we have sufficient vaccine supplies during the COVID-19 situation. And just one point from the World Health Organization, actually. So as Thailand continues to prioritize health security and measures to strengthen public health infrastructure, we have inaugurated the third global pilot review. It's called the third global pilot of the Universal Health and Preparedness Review. And this is a crucial step towards sustainable health security, which will provide a conducive environment for post-COVID-19 economic recovery and a revival, rehabilitation of people's livelihood. And on screen, actually a commendation from the Director General of the World Health Organization, Dr. Tedros, on this issue. saluting the Thai government for championing it. Of course, challenges still remain. We must not rest on our laurels. We're on the way, I think, towards a positive downward trend, hoping for the very best. As you see, gradually we're opening up. Gradually, the measures have been lifted. Gradually, the numbers, the daily numbers, have actually been on a downward trend. If you observe on a daily basis the numbers. So hope that you stay safe and healthy. We'll be talking to you around once a week until any further changes. We thank you very much for your continued cooperation and your attention. We hope the very best for health for both Thai and our foreign friends here in Thailand, and hope to see you again next week. Thank you. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน